My name is Amy and I'm representing Doctors for Nutrition on behalf of our amazing CEO, Rebecca Stonewall. So we are an organisation, we're a not-for-profit, that educates doctors, healthcare professionals and the general public on the role of plant-based eating in the prevention and reversal of, in particular, chronic diseases. And we do that through a few things. One thing we do, we hold amazing conferences, so bringing doctors' voices, all different sorts of professionals, and we're going to be here in November, so just giving a shout out. We hope to see you all here in November. We are the sole voice in the Southern Hemisphere in this space, and I think it's great that we're here because, again, as a sole voice, it can get a little bit lonely. But from a health perspective in relation to this panel, we see the same thing driving all crises at once, right? Chronic disease, climate breakdown, animal suffering, they are one in the same, and by working to, the same goal of reducing people eating animals, we will actually, help change all those things at the same time.
Hello, everyone. I'm Kate Grigg. I'm representing Voiceless. We're an animal protection organisation, and the last 4 or 5 years we've actually solely focused on being a movement builder and a grant maker within the movement. And so our role really is to address the root cause issues of animal suffering and exploitation. And we go about that. We run an annual grants program where we're actually seeking systems-led projects and ideas, solutions-focused work that actually tackles those root cause systems-led issues. And so an example would be tackling, the deeply rooted systemic issues within the food system that we're speaking about today. And actually our role is to make animals part of that conversation, so not have them be that elephant in the room, not a side issue from this discussion, but really central to addressing the systemic problems within our food system.
Hey, my name is Dave Kendall. I'm a TV producer and journalist, and editor by trade. I was raised vegetarian, but I didn't become vegan until relatively recently. And I had no idea of the connection between diet and climate change until I read an article in the New Yorker in 2019. That's when I learned that 1/3 of greenhouse gas emissions come from agriculture, and 20% of that, at least 20%, comes from animal agriculture. So I, as part of my dissertation for my master's, I built a website called livestockclimatefacts.com. And I've developed that and social media channels as a resource for animal welfare organizations to use the climate change argument, and also to educate the public about the connection between animal agriculture and climate change.
It also just reminds me just how people come to veganism. And that's why it's important, isn't it? These different languages we use, because we never know where the seeds are sown and where they're going to be watered, or in fact, the harvest is made. So Amy, back to you. So Doctors for Nutrition advocate for whole food plant-based diets. I like to call them plant source diets to prevent disease. How do you see the health community's role in bridging common goals with environmental and animal protection groups?
So there's a lot of data to show that most people come to changing their diet and going more plant forward due to their health, right? We would love it to be for the animals, we would love it to be for the climate, but it's generally for themselves. And that's fine. Any way they come, we will take them. So I really think that the health space, we're very unutilized because this is where the majority of people are going to come in. And unfortunately, 9 times out of 10, they go to their doctor with, high blood pressure, diabetes. The doctor will never say you should be more plant forward. And if a person brings that to their doctor, it almost always gets shut down. So we see our role in kind of 2 spaces. We speak to the healthcare professionals, but we also educate the public, again, because the push is going to have to come from top and bottom and meet in the middle. And so I see our role as kind of translators and bridge builders. So we take the evidence, strip it out of the industry, spin and influence, and we help people connect the dots. Oh, this way eating is good for your arteries. It's also good for the planet, and it's also the best things for the animals we share this planet with. So a lot of people come through that channel, and I think we really are underutilized. As I mentioned, we're the sole voice kind of trying to get into this space, but really as the bridge builders and kind of that entry to people starting to think about that change.
Right. I'm going to move over to Dave, actually. Dave, from your lens on food systems and sustainability, what opportunities do you see for cross-sector collaboration that genuinely addresses the root causes rather than the symptoms?
I think, hello? Yeah. I think the initial question is just understanding, is one of education, understanding that it takes 33 plant calories to make 1 calorie from beef. Yeah. It is the gross inefficiency of eating meat, about cycling plants through animals. Basically getting that message across is the most important. So what I want to do is make these key data points available to animal welfare organizations so that they can use climate change as a kind of a gateway drug to people who may be resistant to the animal welfare argument. Pretty much everyone is aware that animals suffer and die because of the way we eat. Not everyone is aware that animal agriculture is destroying our planet. So that's a key element. As far as human health goes, aside from personal diet, a lot of the gross air pollution in Southeast Asia is due to crop burning. And these are crops planted for animals. It's animal feed. So, and there's also the connection of zoonotic diseases coming from transmission from animals to humans. 3/4 of all new infectious diseases are actually transmitted from animals. So these are other elements. This is how animal agriculture ties in with human health.
Yeah. Thank you. Please, anybody pop in if you feel you want to add anything to anyone else's comments. If not, I think we're just building up as we do these questions. Kate, let's move to you. It's Voiceless works to reframe social narratives about animals and justice. How can these ethical narratives strengthen the broader arguments for planetary and public health?
Yeah, I mean, I think they all complement one another. I think, if you think about climate information, health information, that sort of tells you what's happening, and that's statistics, information, and I think a lot of people are brought into, veganism, plant-based lifestyles for those reasons, but I think ethical narratives can really sustain change over the long term. If you think about, people can instantly go, oh, that's terrible, this is going to affect me as a human being in terms of my health, what that's going to mean for my future, my kids' future, those environmental statistics. But I think ethical narratives really raise moral concern. And I think when people get into the movement for health reasons or climate reasons, then their minds and their hearts are more open to those ethical narratives. And that really holds you when you learn about who's paying the price for our food choices. That really aligns your values with your behaviour and it keeps you accountable on a daily basis. So I think that can really sustain your vegan lifestyle for the long haul when you start to understand the ethical and the moral reasoning behind our food system. And so that's what we try and do, right? And when I mean ethical narratives, I'm not talking about blaming or shaming people. Yeah. I'm talking about more compassion, empathy-led storytelling. So bringing the lives of animals as individuals to the forefront. I think, when you tell the story of an individual animal and their pain, their suffering, their joy, their well-being, etc., empathy is evoked when you start talking about the billions of land animals and the trillions of aquatic animals that are slaughtered every year. That just becomes a statistic, and so that empathy isn't really activated. But when you bring individual animals' lives to the forefront, and that's what we try and do, or supporting organisations that are doing that, then that ethical and moral reasoning really is activated and that can sustain your change that you're trying to make long term.
Yeah. And I think that's a reinforcement to everyone, isn't it, here? Because we all know this. We know that, from an ethical perspective, even if it's the worst diet on the planet, I'm sure everyone would put their hand up and say, I'd probably take it rather than contribute to this. But it's sharing that with those other groups, isn't it, to actually bring that in. And we know when there's public story on the media or something, the cow, I'm thinking, the calf that came off the back of a truck and was running down the road and was rammed by a police car. All the public were coming out from their houses saying, don't do this. And yet that next leap to say, well, how does your behavior be part of keeping the system? We've got to be really skilled communicators, haven't we?
And it's removing them from being like a production unit in this vast food system that exists to an actual individual. And, if you think about some of the amazing sanctuaries that we have here in Australia, Edgar's Mission, how they tell stories of those animals, even if you've come to it, vegan lifestyle from a climate or a health perspective, you can't help but have compassion, and that then can be activated, which is amazing.
Yeah, absolutely. Let me ask a question to all you and just throw it open really for discussion. If the public could clearly see how that's going to happen, how it's intertwined, the goals of climate and animal agriculture and food are intertwined, what mindset shift do you think is necessary to get people having this dialogue?
So I think, people seeing, if they're able to recognise that they're all different expressions of the same problem, they will move away from seeing all of these three courses as kind of separate causes, and that they're not competing, that essentially we're all trying to work to fix the same problem, which is essentially arresting the growth of a huge, powerful industry that is on a upwards growth trajectory. It's only getting bigger and bigger every year. And, if you think about factory farming in the global south, it's on a steep increase. So the problem's only getting worse. Yeah. So I think if everyone can start to see it as different expressions of the same problem, then from my perspective as an animal protection organisation, hopefully people will start to understand that compassion's necessary. And so thinking about animals won't become abstract or, you're having to make a personal sacrifice. It will just be seen as the right thing to do, and that we've got to consider animals amongst the health and climate issues.
Absolutely. Yeah.
Yeah, I think it's so important. I think we need to look at it, particularly the climate change argument, as an opportunity, because the level of ignorance is so high. That there was a survey done that 3/4 of Americans are not aware that there's any connection between eating meat and climate change. And in my personal experience, I think that's an underestimation. I would put it more like 90%. So this is just a huge opportunity to use climate change as a way to get people to think about their diets along with health.
Yeah.
So it's about the health of the body and the health of the planet, and definitely the health of all the animals that we kill.
I agree. I think Claire and David said it wonderfully. When we talk about food, and particularly nutrition, where does it come from? Right? We're just like, eat meat, drink milk, and that's it. That's the end of the conversation. And it's a real problem in the health space and in the nutrition space. It's very technical and scientific, and we just look at things one by one, and it should never be like that, right? If your shoulder hurts, doctors just look at your shoulder, they don't look at your knee. And sometimes those two things are correlated. And particularly, my background is in nutritional medicine. We talk about things being most bioavailable as if they're the best, right? So meat is the most bioavailable source of iron or protein. Okay, just because it's the most bioavailable, it still increases your risk for cancer, heart disease, cardiovascular disease. So people think bioavailable is best and it's kind of superior, and we just leave it at that as opposed to unpacking that further. If something makes you sick, the planet sick, or causes harm, it's not the best, right? But it's just still spoken in that silo instead of, uniting and speaking about all of the things at the same time.
Yeah. No, absolutely. It's, I feel every time we have a topic like this, we can open up so many questions, and I've got so many comments. And I do love Dr. Will Tuttle's definition of veganism, which encapsulates all of this. He says, it really is a philosophy of loving kindness Loving kindness towards ourselves, what we eat, what we think, how we live our lives, how we express ourselves. Loving kindness towards all others. And that's often for us, seeing people that doing bad things, so to speak. And perhaps our behavior towards other groups, we don't feel are doing the right thing. Also a loving kindness towards all animals. Don't have to tell anyone here about that, but it's extending it beyond the cats and dogs, isn't it, for the public, but also towards all ecosystems. So we know it's the Swiss Army knife of the solution. It's how do we connect those connections and how the bodies, which is what you're doing, the profession was systemically through policy and things, working on this. So Dave, over to you. When you look at this as the opportunity, almost the gateway, barriers. Now, what systemic issues do you see, such as government policy, economic systems, closed minds, cultural narratives, hinder that unified change for in the environmental sector?
There's
Big
a lot.
question.
There is a lot. And, the statistics are pretty grim. We're looking at a 90% increase in meat eating in 2050 with the way things are currently tracking. I mean, it's pretty grim. Barriers, there's a huge cultural barrier. We've grown up in a culture that makes people think that eating meat is healthy, which is, essentially a lie. But that's what most people think. That's what we're raised to think. Another one would be eating meat is a sign of prosperity. The reason why this 90% increase is projected is because of the rise in incomes. As people get richer, they think, oh, I can afford meat now. And that's a sign of affluence and prosperity. That's a huge cultural barrier. Then we're talking about governments, and this is true in both democratic and non-democratic countries. The animal agriculture industry is immense and immensely powerful. It's a multi-billion-dollar industry. They have fingers in pies all over the world. The amount of money they spend on lobbying for favorable regulations and enormous subsidies is absolutely massive. Yeah. So that's another huge barrier. What else notes do I have? Yeah, so we've got the cultural narrative that it's being rich and that it's being healthy, the straight lie. And then there's the disinformation campaign that's run by big meat. I found a website called californiagrown.org. And let me read you something from it. The headline was, "Stop worrying about cow farts. California's dairy industry is using them for good." And the article says, many California dairies are using the methane that cows naturally produce to create clean energy. The resulting natural gas and fuel powers farming and dairy operations, nearby homes, and even vehicles. The article touts the extremely expensive, heavily subsidized and inefficient methane digesters and these other so-called smart sustainability solutions that just amount to greenwashing. They're completely insignificant and they're very expensive. And then the article says, here's a fun fact for all the folks who think that eradicating cows is the answer. Vegans actually fart more than omnivores. Gosh. Like, the implication is that vegans are the problem, not livestock. So I assumed this disinformation website was produced by the dairy industry. I scrolled to the bottom of the page. Copyright 2026, State of California, Gavin Newsom, Governor. There you go. So, and California is one of the most progressive U.S. states. It just shows how much the animal agriculture giants have virtually taken over state government. It's very depressing.
Yeah, absolutely. And I don't know if Angie's here, Punky Pies. Hopefully she's putting our pies in the oven. But she had, when she was talking yesterday about JBS, the biggest meat distribution conglomerate, really, they were the inaugural investor in the Donald Trump campaign, being the biggest one. The initial one was 5 million, which gave them a voice, of course. And now we've got the new food pyramid, of course, we know, which is absolute nonsense. But you can see where the investments, that was the first investment they made as to help his campaign. So we just have to follow the money, I guess, the absolute greed. But that's not everybody. We have a lot of whistleblowers coming out of that, of course. Yeah, it's okay. Amy, what about the health sector? Okay, how can education and professional training better integrate those environmental issues and ethical awareness to help people like doctors and dietitians become change agents?
It's a great question, and I had to reflect on it a lot, because even getting nutrition, what Doctors for Nutrition does, into the medical field is very, very hard. So that's kind of why Doctors for Nutrition was born, because nutritional training doesn't exist really in medical schools. I think on average they get 24 hours over a 10-year degree. And sadly, you think it would be in a dietetics or nutrition degree. I only did my degree 5 or 6 years ago, so quite new. Plant-based nutrition is completely absent, and worse than completely absent, they teach outdated, incomplete proteins and low iron and all this sort of stuff. So, it'd almost be better if they said nothing at all, but they're actually downplaying it. So Doctors for Nutrition was born out of this necessity that this conversation is not even in that space yet. So that's our key barrier, that we're not even kind of in the door, or it's not even something that's already being talked about. And the medical world is slow to change. There's a story of, it's a very old story, but there was a doctor, it was actually a nurse, who said to the doctors, I've noticed that there are more problems with babies that have just been born in the hospital after you guys have been down in the morgue, practicing on your cadavers. Maybe you should wash your hands. Right? So this doctor took that idea as his own and ran with it.
Oh, yes, I know.
What happened to him was he was disbarred. He was kicked out of the medical world for demanding a small change like washing hands. So it's kind of what we're up against, but I'm very, very hopeful. So the same barriers are our greatest opportunities. So we have had a great, reaction to the content that we produce, the education. We're now aiming to always do one for the general public and one for the medical practitioners, so that both sides get that. And people are really, really interested. And the biggest thing for us is the science is solid. You can try to argue about it, like that website with the human farts and all that sort of stuff, but it's just wrong. And plant-based diets are solid. The science is amazing on it for our health, and also what's coming out much slower because of the barriers that you mentioned, Dave, the harms of consuming animal products. And so I'm really, really hopeful that in time, the fact that the science cannot be debated is what's going to get us in the door. And then when we open that door, along comes climate, and then along comes animal rights. Again, what I said earlier, we can't just talk about things in a silo. We will for a little while, just to, with the type of people that we deal with, but the science is fantastic, and we're really seeing that tide change. Doctors understand, like, if this works and if this doesn't work. So when they see that change for themselves, they really, are not overly, they're quite younger they are, especially happy to reanalyze and, remake the way they talk and the way they lean into things, which is really cool. So, there's a big barrier, but once we knock it down, I think the floodgates will open. For sure.
Absolutely. And a wonderful example of that, those sort of scientific, between those hands down, the most healthful diet is Dr. Neil Barnard now taking that legal case against the government, not only on the facts and the figures and the evidence of the plant source, but also the corruption of the misrepresentation, the vested interests that were contributing to that sort of thing. So,
and sorry if I may say, that's a great example of as soon as those guidelines came out in the US, everyone went, absolutely not, right? Like not just our space of not just the vegan community. Everyone went, hang on a second, this doesn't look right at all. And the corruption and the blatant, thing that was behind it. If you do want, when I show people dietary guidelines, I show them Canada's dietary guidelines, the only ones that were done without industry input. And that's what I show my patients and clients.
That's interesting. Great. Okay. And now moving along swiftly, because we're timing wise, I knew this was we could talk so much. We need a workshop on this. Kate, over to the animals, of course, can you share an example where advocacy for animals is successfully intersected with the environmental or health campaigns? How did that collaboration succeed?
A good example, we work with an organisation, an Indian NGO called A Just World. And interestingly, the founder of A Just World used to run FIAPO, which is an alliance of 50 animal groups in India. And she left FIAPO because she felt like they were just too silo-focused. And so she's taken a systems-led focus in the work that she does, and she is basically getting a group of animal organisations, environmental organisations and also public education organisations together to go into schools in India to run plant-based education and change the lunch school program in India. So back to Dave's point earlier around the growth of factory farming in the global south, particularly in India, what's happening there, even though, traditionally everyone thinks that they're a vegetarian society, the growing middle class and the younger generation in India, they are looking at meat as a sign of wealth and success and modernity. Yeah. So in her perspective, the animal ethical argument wasn't going to enable that plant-based school education. So she's gone in and having alliances with alliances with environmental groups and health groups. It's given them access, critical access into these schools, and they're running these lunch programs in all of the major urban areas in India. And within 6 months, so much has changed. Thousands of meals are being served, and the change has been quite critical. So, I think just being able to align with the other groups in a culturally relevant way has been great. And also, I'd say another example that we've been able to focus on is supporting cultivated meat. So I don't know if Paul from Magic Valley is here. Hey, Paul.
Hi, Paul.
Hi. That's a great example of the intersection of an idea and innovation which addresses dramatic animal suffering reduction, significantly reduces climate impact, and obviously it's a clean version of meat eating. So I'd say that is a fantastic example and needs support.
Sure. And different people have different views on that, of course. And there's a topic this afternoon, a discussion group to have those sort of conversations. But I'm absolutely, and Paul hopefully will be at that as well, I hope, to contribute. And thanks for his work. And, I can't help thinking of, we're talking at a sort of macro level, systemic, the organizational role, the education, the policy connections. But to me, all of this is a reflection of how we ourselves need to have those arguments to meet people where they're at. What people talk, they're talking diet or environment or animals. And of course, our job, I think, is ethically to bring it back to the imperative of what this is. But, bridging people on that is we can't say, well, that doesn't really important. It's important we look at this. We've got to be pretty little micro versions of this, of course. Now, open to everybody here. And I'm probably an MC who hasn't got a watch on her. I will look in a moment. But let's spend a little time on this. Awareness is growing. It's fair to say, and I think both of you sort of highlighted it, but action often stalls. What would it take to turn public interest into vegan lifestyles from institutional or just government commitment? That makes sense? That was a question we agreed. Right. What would it take to turn public interest into vegan lifestyles into institutional or government commitment? In other words, government policy following a surge from the public. What was it going to take to change individuals to demand this, really, in there?
I'd say one answer to that is just let people know about the level of disinformation and the fact that several, on the subject of cultivated meat, several US states have banned cultivated meat, which is clearly pressure from, they'll say it's because, yes, but eating beef from cows is somehow natural, as though cows are natural in any way. They've been specifically bred to be the docile creatures they are. There's nothing natural about, it's the agricultural revolution 12,000 years ago. Before that, there was just hunting. And where the animal raises itself, it's just a blip in the history of our species that we've farmed livestock, and the fact that it's so inefficient to farm them that we have to give them food every day, again and again and again. 33 plant calories going in to make 1 calorie of beef. Just the inefficiency of it. There's nothing natural about that. But anyway, the U.S. state example is that's another example about. So I think letting people know the level of disinformation and the power of the meat industry is one way to do that. As far as how to influence governments go, I think I defer to Plant-Based Treaty on this. I think they've done some really good work. So examples of what they're doing, petitioning local and national governments to declare a climate emergency and sign the Global Methane Pledge, reducing or eliminating subsidies for animal agriculture, introduce regulations that limit or ban the expansion of factory farming and monocropping for animal feed, calculating greenhouse gas emissions based on consumption, and developing a food strategy for climate action plans that prioritize a switch to plant-based foods and public education, and mandating carbon emissions labeling on foods such as retail. Now that is something that the animal agriculture industry has successfully prevented from. There was a plan to show the climate repercussions of the food you eat. That was shelved years ago in the US because of animal agriculture opposition. They just don't want people to know the facts. They don't want people to know that the level of greenhouse gas emissions from the food we eat, it's like beef it's not twice as many emissions, it's not 3 times as many, it's 60 times the emissions, greenhouse gas emissions, to get calories from beef as opposed to beans. So I think the plant-based treaty is doing great work.
Yeah. Anyone else want to comment on that?
Yeah, I was just going to say, I echo Dave with transparency. I think when people find out that, their diabetes could have been prevented or, reversed, we can reverse type 2 diabetes with the correct diet and lifestyle change. You could have prevented your heart attack. People get really mad, right? Cancer, why do people get upset when they hear about cancer? Well, it's the alcohol and it's the meat. And once they are aware of that, that's really kind of empowering. I did an advocacy course during uni, and we had to come up with a whole advertising campaign on how we'd make a change. And mine was red meat, but done the same way as like an anti-cigarette smoking campaign. So saying to people, you don't know this, but same like the cigarette industry, the meat industry is blocking this science that shows us that red and processed meats give cancer. You wouldn't give your kids cigarettes, so let's not give them red meat. Take it out of your trolley. And my lecturer was like, oh, I didn't know any of these things. But again, that sort of informing, not blaming, because we are being lied to. People really take that on board, and we see a lot of motivation. I think from a policy standpoint, and it sounds very shallow, but money. Right? Governments are under pressure about the cost of living, but also a lot of that budget is going to health. Our hospitals are overwhelmed, medicines are costing a fortune, and we have a solid answer on how to make people live better and longer, and bring down that. So for me, policy change would be at the top with money, and explain that to the government and then to the public where their money could be better spent as well.
Just quickly, I think that just at a macro level, I'd just like to say that I think the systems that we have in place are kind of designed for people to make the current choices that they make. So I kind of think it's really hard to put this on individuals, and I think we all carry such a huge weight of responsibility. But the thing is, the system's set up for everyone to fail. So I think that, the systems-led work and the food systems advocacy is such an important area, because unless we fix the systems, just the individual fatigue to make better choices is just too hard. So we need to kind of design the system to enable people to make these choices, that we want them to make, and that that's everything from supporting innovation, so the government backing market transformation with plant-based meats and cultivated meat to enable their growth through public and private funding, giving them fair regulation so that what's happening in the US won't happen in Australia, the right infrastructure, all the education within our school systems to be plant-focused, to introduce more of that compassion learning, thinking about food service, in not only in schools but universities, hospitals, private institutions, all of those things. There's so many different layers, and it's such a vast system. So I think if we asking individuals to make the change, that's very, very hard. So I think focusing on systems change and all those various factors within those systems are important. And again, that sort of highlights the requirement for everyone to work together on those shared outcomes. Yeah.
And I think at the individual level, because we're often talking to people face to face, aren't we? And and people don't want to be shamed. We know that. They also don't want to be duped. And that's such a powerful thing, isn't it? And hopefully we're doing this already, but just even using the word we have been duped as opposed to you've been duped, the government's lying to you, they're trashing the planet, they're killing the animals, they're destroying your health is, hey, we've all been lied to here. And asking a question, let's use a bit of neuroscience here. How much do you know about, the effects on the environment of the agricultural industry? Oh, well, I know, etc. I actually did a bit of research on it. Can I tell you? When we ask someone, can I tell you something? Even if you're in the middle of a conversation, neuroscience is telling us they almost feel they've got a choice. Well, I could say no. So you can't say you're preaching or blaming or shaming because you just gave me permission. Something as simple as that. And we don't need to know all the details that, people working in organizations are, but we need to know sufficient. That's where documentaries come in beautifully, don't they? They can be great sort of forms of advocacy. We don't have to know all the facts, but we do need to know the key arguments, I think. So, gosh, we'd be here all day. We love talking about this.
Sorry, can I just say one more thing? I think redirecting subsidies towards farm transitions is also a huge issue that needs to be focused on.
Yep.
So if you were to take, because I think that's the other thing, you can't not have empathy for, the huge farming community that exists in Australia. And that's such a huge part of our culture as an Australian. So I think the idea of farm transitions would have so much relevance and so much traction if the government could understand that and that they need money redirected to give them new income streams, right? And I think that's a huge area that should be considered.
Brilliant. And of course, the AJP, and I know Emma has particularly been talking, I've even seen her talk, online, we've seen her talking about those subsidies. So, it's all those little channels, isn't it? Speaking in the language that people need to understand. Hey, Amy, okay. Maybe you've answered this already, but we could sort of build on it. Health data often speaks strongly to policymakers, as you know. You said that, politicians want to save money and things. How can evidence-based messaging about those diet-related disease reductions open the doors for broader reforms?
Yeah, absolutely. So I did touch earlier on the cost as well. And then Kate just touched on it, my next point actually, that kind of broadening into institutions. So again, one person, it's very unfair to put, this on people, but to push the government, pressure the government to lead. So I would love them to start, acknowledging the harms of certain foods. And then you can say, okay, well, if that's the case, why are we serving it in hospitals? Why are we serving it in schools? Why are we serving it at daycares? And so then that opens that door, I think, which pushes through. And it's almost like the health data is the Trojan horse. It gets us into the health conversation, and then the climate guys jump out, and then the animal welfare guys, they jump out, and we're kind of all in there together. Because when it is government, it is numbers and policy, and it's not about feelings and sentient beings and things like that. But as I've mentioned, the data is just so solid on plant-based diets for health, human health, planetary and animals. And I think that's really the big in. And then hopefully, that's a domino effect of getting that into that space. And then it becomes normalized. When someone's doctor says to them, oh, that's a great idea, definitely, start eating more whole plants, move away from animal products, it just normalizes it and they become much more accepting. So I think if we have that kind of top-down trickle and we're not so niche, this is just a general broad recommendation that we're seeing. But I think the health data is highly underutilized, and it's something we can really, really push to drive through.
If facts alone were enough, everyone would have to be vegan, wouldn't they? For every reason we know. And there's the psychology there also of the doctor, isn't it? And the policy maker is what's in it for them? How can they look good? And also the adherence to authority, how people give away their power to professionals. My doctor said it's okay to eat donuts every day. I'm sure, we have that situation. We got Dr. Kevin Coleman here, testimony to how much people often don't think themselves. So, okay. So, Kate, the storytelling you were talking about, something that is so powerful, the individual stories and things. You often leading, as you said, with compassion-driven storytelling. We all want to hear this one. How can stories of animals' lives move more audience who might otherwise respond mainly to environmental health arguments? How can we use those animal-based stories to capture hearts and minds?
Yeah, I think I sort of alluded to it in an earlier question, but just kind of reiterating that, I think telling stories, it's well known that throughout human history that storytelling can expand our moral compass. I think it's, again, just focusing on the individual lives of animals, moving them outside of being something abstract, those, seen as units in a production system, and telling their stories and showing, their lived realities, showing them as, ethical and political stakeholders and deserving of our moral and ethical concern. I think that's, I'm not saying, I think all of these narratives and stories will complete one another, so that whatever pathway someone comes into considering veganism, we're giving them as much information as possible, but hopefully the compassion-based storytelling is going to sustain their interest and their commitment for the long term, right?
Yeah, absolutely.
Yeah.
And the same in each of these stories, isn't it? Is, when people look at the emissions and things, it's all too heady, it's all too much. But when they talk about what's the future for their children, what's that going to be like, Granny has diabetes and she could have prevented that. It's those individual stories of change, isn't it? That gets the hearts and minds, and then is backed up with all this sort of stuff. I think we might even have a moment for a question in a moment, but I want to just ask a question generally here, because, where do we go from here? I'll have one at the end as well. If we look ahead to 2030, just as a date we've chosen, what tangible outcomes would you love to see this united movement achieve, whether in public health policy, food systems, societal values, mindset change? What tangible outcomes do you want to see this united movement achieve?
Okay, I'll go quickly. I would love, as a grant maker, to be supporting examples like I gave in India, as Australian organisations. So I'd love an organisation to come and say, we need funding because we're going to, we want to work on school-based lunch, programs in Australia, and we're an alliance of environmentalists, animal protectionists, and nutritionists. I would absolutely be so supportive of a project like that to back here in Australia. So more of that alliance building. Obviously, in an ideal world, I'd love to see a food system with zero animal exploitation and suffering, but that's 2030, so stretch goal. Just a movement that's united on outcomes, less on purity and pure focus on, this approach is wrong, you should be doing this, and just not perfection, but shared outcomes and being solutions focused and collaboration, not shaming. I know this is controversial, but not sort of marginalising people who have different political views, because I know a lot of people with political views that perhaps I don't share, they're not my own, but they care about animals. And so that's an opening to bring them into this conversation, right? So not marginalising people. Yeah.
Do you know that thing about subsidy is interesting? I was listening to a podcast the other day on hope for the animals. You're in the car and you're listening to ones. And it was an interview by someone working for Wildlife SOS. And where they used to have dancing bears in India, they've actually ended that completely. Bears were taken into the halls of royalty and were dancing for the thing with all the awful training that goes into that and cruelty. And Wildlife SOS were working with these, how do we stop this? And yet it's people's livelihood to take them into these places. So they worked locally, they worked internationally, so they had funding for local towns to transition, to train, stereotypically, the father of the family, how to run a business. The women were re-educated because they were in areas where they didn't. They had new businesses running. They have ended bear dancing across India by taking a systemic approach at the financial, environmental, certainly the ethics, but also people being able to care for their families. So, there's lots of stories like this. Whereas, if I'm over there and I see dancing bears, I know and most people's immediate reaction to that. We've got to be quite sophisticated, haven't we? So in that one sort of thing. Okay, let's just have both answer. We could have probably one or maybe two questions in a second. Please, Dave, if you comment on that one first.
Yeah, the statistics are 83%, half the world is used for, half of habitable land across the world is used for agriculture. And 83% of that agricultural land is for animal agriculture, even though it only supplies 18% of the calories and 37% of the protein. Now, I don't expect everyone to remember those statistics by 2030, but I just want people to get the concept that we have turned our beautiful planet into an animal farm that is killing us, and it is destroying our planet. So that is one key goal would be to just make people aware, that people know what is going on around them. And the other one would be just we all work together. Yeah. We all work together for the common goal. And that by 2030, there is a significantly greater proportion of people in the world who are vegan.
Mm. Hallelujah.
Gosh, 2030 is so close, right? We should have picked a further away number.
Yes.
The Australian Dietary Guidelines are being released later this year, and I would love to see the science of plant-based diets reflected in that. I'm sadly not holding my breath, but I'm holding a little bit of hope. I know people don't follow the dietary guidelines, but when institutions like that do come out in support of the science on plant-based diets, it just normalizes it and takes it away from the niche. And to echo Dave and Kate, I think just a little bit more unity. And I think even though we all want to be united, understanding that each section knows what they're doing or is taking on a different, angle, right? We often get asked why we don't use the word vegan. We use whole food plant-based. Vegan is, a belief and a lifestyle and an ethics, right? It's not actually a diet. When you tell someone that you're vegan, all you're doing is telling me what you don't eat. You're not telling me what you actually do eat. So from a health perspective, we do use whole food plant-based because that's where the data is. And I think little things like that, just going, cool, Doctors for Nutrition, that's what you guys do. That's what is happening in that space. We trust you and we support you. And I think, the same across for everybody else, because you're the expert in your, area. Dave, you know what you're doing in yours. And I think, we can all unite across that, right?
Yeah, fantastic.
We have time for maybe one, maybe two questions if we push quickly.
I first of all just want to say it was such a beautiful panel to see all of you guys, because I think an industry that's so harmful for the planet, for people, for the animals, I don't think that it can last forever. And with what Kate was saying with storytelling, I do tours at Edgar's Mission, and on Saturday I had a tour, I had a kids tour, and a grandfather went vegan on the spot. And it's because he heard stories like Clarabelle. If you were at my presentation yesterday, you would have heard her story. And her life has changed the lives of so many animals because just people have heard her story and have realised that cows are not the happy cow on the milk carton that you see. So I think that storytelling is amazing because you get to see animals in a different light. And if you actually get to see an animal, a little sheep wag their tail or a chicken impress their ladies by waiting for them to eat, it's amazing. But with a question I have with Dave, I have done a lot of field trips with wildlife, and I work with environmental scientists and wildlife biologists who will work all day in the field, and they will work trying to help kangaroos, for example, or trying to save little Australian native rats, and then they'll go and eat a steak. And I've been asked, I'm like one of the only vegans out of all of these environmental people that I know, and I just don't know how to get it into their heads that they are contributing to the problem themselves. And we're getting, I think you might know Peter Johnston from Doctors for Nutrition. He's coming to my uni to do a talk on all this sort of stuff to the environmental people. But how else can we get people in that field who are apparently professionals to actually understand that this is an issue for the environment, not just for animals as well?
I guess one answer would be to just make them aware that they're being speciesist. They're just deciding for some pretty random reason that one animal is worthy of protection and the other one is worthy of being eaten. And the other element would be, do they know the extent to which their diet is wrecking the planet?
Okay. Oh, sorry, Kate.
We're just a bit short on time, but if you wanted to...
We just have one more question.
We have another question, I think.
Okay, just a last short question. This will have to be our last one.
Thank you. I'm dying to ask this. A couple of years ago, the International Court of Justice said that governments who don't implement climate protective strategies can be held to account. And I'm wondering, how close are we in Australia to a test case?
Interesting.
Yes.
It's a great question.
Your
and
job,
I don't
right?
know the answer.
Your question. Yeah. We haven't got an answer for that, but we will come back to you.
I think that's actually a fascinating question and
Yeah.
something that we need to research and look into because, Australia, we need to kick the butts of these politicians
Absolutely.
who keep pushing the meat agenda.
Any chance we could have one more? Is it possible with Clint?
Got to be real quick, sorry.
Yep, really quick, Clint.
After the last question, it's hard to follow up on that one. Just a question for the panel. The animal agriculture lobby is fighting back. They're doing a lot of work in terms of generative grazing and carbon soil capture to greenwash what is a horrible practice. What can we do to defend against the truth?
One clear argument. The studies that have been done that show that regenerative, easy for me to say, regenerative farming is actually carbon neutral are based on completely artificial arguments. But I think that the biggest, I would just say, if the entire world followed the Australian diet and all cattle were being grazed, we would need 6.5 more planets. We just don't have the land.
Yeah.
To eat beef that's raised on grass. Simple as that.
Yeah, and just having those statistics as well as it to hand, sort of thing. Are we good to? I was going to ask you a call to action, but I think we're just about there.
We're out of time.
Yeah. Could I just to thank the panel, but I also just wanted to say, many years ago, I was told by a very wise advocate, and some of you might know her, Lynn White of Animals Australia. I think she was the person who told me I'd become vegan. I wasn't too sure because I came vegan before I knew there was a word for it. That's how much things have changed. And she said, Claire, she was talking about social change, and she said, when people come together, unite, start working together and say, we can do better than this and we will, that's when change really happens. And I think those words were very wise. Thank you, Lynn.